I'm not the kind of person who's like, we should shoehorn people into like different positions or things because of their personality types. But when we look at the natural tendencies, there's a reason that the medical field is like overrun with SJs, any of the SJ types. And it's just because, attention to detail and executive decision and organizational skills, the ISFJs, the ESTJs, all of them. And I think that what I really see when I look at people who are interested in medicine and personality types is a lot of the times the SJs kind of naturally settle into that. But then you look at the types who aren't that. And when you find people who are interested in something like medicine, for example, but it's not, say, for example, the most natural fit for their personality, that's when it really shines. And that's, I think, one of the biggest things with personality growth and development is if you have someone who has an interest that may not be in their most natural personality fit, then you can spend more time helping them try to manage the issues that might be there for them. Say, for example, INTJ doctors, they're going to have a lot of struggle, I would think, because in the medical field, there's tons of paperwork. You got to be aware of medicine. If you sign one wrong prescription, you're done for. So if I was working with an INTJ doctor for some reason, I would say like, hey, pay extra attention to these things, or, like hire a secretary or something who really can pay attention to these things for you. And it would be the same with any other type in any other field that might not be as natural to them. But just because you are one type doesn't mean you can't find yourself really driven towards one certain field. That just means you're going to have to take extra steps and precautions. Because if you have competent and fulfilled doctors, nurses, scientists, biomedical engineers, then you have people who are going to make more progress in that field.
I imagine there's a kind of there can be a barrier sometimes between doctor and patient. And sometimes, with my own experience with the NHS here in England, you might get prescribed to take medication, you might get prescribed to do certain like exercises, like I've done some physiotherapy, for example, and that's a part of the healthcare system. And you need to be able to trust that the person understands why they need to be doing it and what they shouldn't be doing, because that would make it worse. And also that they'll just be able to stick to the schedule that you give them. And I think personality type and stuff comes in wonders there. Because first of all, it allows for effective communication, because you know what the person's brain is drawn towards, what counter reactions they might have. Some types literally seem to have more aversive salience, and other ones seem to have more incentive salience. So that's optimism and pessimism in many ways. So keeping in mind that can also do wonders, because then you can phrase things in the negative way, or you can phrase things in the positive way, depending upon the type. And it's just a correlation. So you still need to go into the individual within the type, but that's a useful one, I find. So I'd call it maybe the medical homework aspect. I think in terms of medical homework, I think type could be really, really useful. Communication and the homework, and making sure types can do the things that are assigned to them and don't make the condition that they have worse, because every type is going to be doing different things that could exacerbate or make it better. I think a big variable here that's getting in the way is a lack of time as well. I feel like some functions, if I'm giving you a kind of like a TESE answer, it's going to be a lot more short and concise than an NITI one. So like a lot of the time, people in the health professions across the board won't have time to kind of like to break it down. This is how it all relates to this. This is exactly how. So it's like you're going to get a different service relative to the amount of time people have on their hands to give you a service in the first place. And I think the more time is constrained, well, the more we narrow down our function time window, which is more sensing anyway. And so that means, the more time that we have, the more time a doctor has in order to explain something, the more time a doctor has in order to diagnose a patient before, it's like it's an emergency situation as well. That gives us more time to kind of go into that intuitive landscape of possibilities and abstract and potential alternative treatments. But so I guess it's always going to be relative to whether or not we're in a pandemic, for example, et cetera, the extent to which we can we can afford to keep someone a little longer in the hospital, and the extent to which on the other side of the coin, we need to get them out of the door straight away, essentially. So I think there's while type is going to be extremely useful, no doubt, the extent to which certain function pairings can be fully expressed and realized in a beneficial way is always going to be relative to the amount of time that people have available to use them. From this perspective of the medical practitioner for themselves, of course, it's the value of knowing what kind of a doctor do I want to be and what kind of things give me energy and what kind of position fits me best. Specialty, it can be about how you practice it, and it can be about
how you make it happen. Because yeah, maybe okay, you really love being a doctor, you really enjoy it, but maybe there are small things about it that cause you stress, or patient contact questions, like things like that that you're unsure about or that you don't feel fully comfortable about. So those are good things to question and ask for yourself, and also to talk with your managers about, like, how can I make this role fit me as good as possible? How can I be at my best for the patients and for myself? Then from the perspective of knowing and understanding the patient's type, I think it can help, of course, with knowing how to communicate with other personality types, but it can also help with respect, because sometimes it can be difficult when a patient doesn't understand you, or if you're not able to explain the process to them, or like to help be as good of a help as possible for them. So maybe by knowing their type, you can communicate with them better. But I think most importantly, you should be very careful with how you do that, because most of all, I think you just want to be aware of the biases that you might have, in terms of thinking that you know better than the other person, or that they are being irrational, or that they're being stupid. A lot of time people have a good reason for why they choose to do what they do, and if you understand it and take the time to understand them, you might be able to guide them to making the best decision possible for them.